Hello, I am Crystal Meyer, and this is Dr. Lisa Bryant. And she is a naturopathic doctor here at Vancouver Wellness Studio. And I'm going to ask her our pandemic series questions. Lisa, through the lens of your discipline, what are some of the most common symptoms you've seen in working with pandemic anxiety?
Yeah, good question. Pandemic anxiety really kind of falls into a type of anxiety that we call situational anxiety. And so anxiety can come in a lot of different forms. So sometimes we see patients with chronic anxiety, they might maybe have this their whole life. It can also be situational. So we see this in other contexts with maybe people suffering from grief or trauma or loss or bullying or work stress. And so we also see that with COVID 19. It's been a very stressful year and a lot of changes. And so some of those symptoms that we see coming through our office um, are similar to regular anxiety that we see. So sometimes we see that as worrying, racing thoughts, trouble sleeping. I've had a lot of patients with insomnia coming in the last year. Even chest pain, sweating, panic attacks. So those are probably some of the most common things that we see. We see a lot of social anxiety coming up and social avoidance, and I think that that's kind of a combination of, we're being told not to do social gatherings, but even, in the context of where maybe it is feeling safe to do so, I see people really feeling uncomfortable in social situations again and not really sure, what they should be doing. And that can be very anxiety provoking as well. So we see those symptoms coming up. Sometimes we see it as muscle tension or even fatigue. I think people are getting tired, and as our adrenals are working extra hard to produce all that cortisol or stress hormone, um, people are really, struggling with fatigue now at this point in the pandemic. So we're kind of seeing all those different symptoms coming through, and always trying to figure out individually what those triggers are, and sometimes even going through like a day-to-day experience with somebody to see when those feelings of anxiety are coming up.
Mm-hmm. Mm-hmm. Yeah. So when you're working with someone individually and you're seeing some of these symptoms arising, what have been some of the best recommendations or some of the most successful approaches?
Yeah, so kind of my first step with these types of patients are kind of taking a step back and always trying to figure out, first of all, the severity of the anxiety. And so, in addition to the thorough history that we do, and looking at different triggers and what people have tried and what that feels like in their own bodies, sometimes I'll use some different screening tools in my office to figure out how severe the symptoms are and how much they're interfering with their life. And knowing that can kind of help me to guide what the best treatment options would be. So I do use some screening tools in my office, and those are just surveys that people fill out that helps me to figure out if it's mild, moderate, or severe. And then we go from there. And then I also just want to make sure that there's not any other underlying conditions in addition to living through this pandemic. So looking at hormones, nutrient deficiencies, always assessing for any trauma history, lack of social support. I find that if somebody does have a stronger social network, sometimes our treatments are more successful. And if they don't, using brainstorming about how we can reach out, whether it's sometimes even scheduling Zoom meetings with friends. And I know we're more familiar with that now, but those can be really beneficial if you don't have people locally that can support you. And then other underlying conditions can be physical, so digestive issues. We know a lot of our hormones, some of our feel-good hormones are made in the gut. And so looking at nutrition, gut health, and doing some screening tests for that. Nutrient deficiencies, so looking at B vitamins, vitamin D, looking at hormones, thyroid, estrogen, progesterone, We know that those things can really affect anxiety levels as well. So always looking for any underlying causes that might be making this worse, or if we don't address those, sometimes that can be an obstacle, maybe why the treatment plan isn't working fully.
Mm.
So the treatments always really vary based on the individual. And so, but these are kind of some things that we'll look at. So, looking at sleep hygiene. And so, that's kind of a funny term, but it describes kind of what we do kind of the afternoon on. So, looking at sugar intake in the afternoon, coffee intake, screen time in the evening. So, I like when my patients can put away their phones and turn off the TV and their tablets an hour before bed. And that really helps us to release a good amount of melatonin from our pituitary gland, that helps us to kind of have a nice deep sleep. And then really setting some boundaries for ourselves about media usage in general. So I'm finding with pandemic anxiety, kind of really looking at it's really good to stay informed, but really looking at kind of assessing, do you have the information you need? Is it time to put away the news for the day? And really checking in with yourself to see how you're feeling about it, and when it's time to kind of put those things away, and maybe doing some things like going for a walk or reading a book. And it's okay to take a break from digesting all the information we're getting all the time. So finding that balance. Also looking at nutrition. So looking at blood sugar specifically, we know that those big peaks and valleys with blood sugar imbalance can trigger anxiety for people, or can kind of mimic anxiety. So watching our intake of processed carbohydrates and sweets, and really looking at getting enough protein and vegetables and fruit and things like that, and nuts and seeds to really balance our blood sugar throughout the day. That can make a big difference. Looking at coffee, so not drinking too much coffee, um, especially in the afternoon. And then that exercise piece. So I like when my patients can get, at least 20 minutes of movement per day. And it doesn't really matter what it is, right? So whatever you enjoy. So it could be just going for a walk, it could be a jog, swim, bike, going for a hike. So those things, it all counts.
Yeah.
But movement every day is a really important part of an anxiety treatment plan.
Mm.
And then lastly, there's some really beneficial herbs that we can try too. So one of my favorites is lavender, and I use something called lavella often with my patients. It's been studied to help people with post-traumatic stress disorder, chronic anxiety, panic attacks. So that's a really nice, safe tool. We always want to just double check it with, herb drug interactions. And there are certain cases where I wouldn't use that, but that generally is a really nice, safe tool for people for anxiety. Fish oil, magnesium, B vitamins, lemon balm, calendula. There's chamomile. There's a lot of nice, really calming herbs out there that we use. Another one that I use often is called GABA. That's an amino acid that really helps to kind of calm down our nervous system. And a gentle meditation practice, breathing practice, journaling. So there's a lot out there, and it's always tailored to the individual. But those are kind of some common things that I'll use in my practice. And sometimes it's kind of we do it in phases, right? So sometimes we start with the lifestyle treatments. We do that for a few weeks, and then we're always checking in and kind of adding things as needed.
Lisa, thank you so much for taking the time to walk us through your approach and what you're seeing. And I look forward to continued conversations in the future.
Thank you for having me.
If you found anything in Dr. Lisa's conversation really inspiring or piqued your interest, please don't hesitate to reach out. You can contact our office and our practitioners on our website, vancouverwellnessstudio.com. Thanks.